Imagine a high school student finally mustering up the immense courage to walk into a counselor's office.
Right.
And they look at the counselor and say, I am drowning. Like, I need help.
Which is arguably the hardest step anyone can take.
Exactly. But instead of getting immediate support, they are just handed a clipboard, a stack of forms, and a 6-week waiting list.
Oh, man. Just a total wall.
Yeah, you could just picture that ticking clock and the squeaky chair in the waiting room. I mean, it's a scenario that plays out in schools across the country every single day.
It is a devastating reality. You have a young person taking the hardest possible step only to hit a bureaucratic brick wall.
Right.
And the psychological weight of that wait list,
Yeah.
I mean, it often does more damage than the initial crisis itself.
Which is exactly what we're looking at today. Welcome to the Deep Dive. Today is Sunday, April 12th, 2026.
Glad to be here.
And our mission for this deep dive is to explore a strategy that aims to completely tear up that waiting list. We've got our hands on a stack of internal documents for a program called MentalSpace School.
Specifically, we're looking at a massive K-12 mental health initiative they are rolling out down in Georgia.
Yeah.
And what we are really analyzing here is a fundamental shift in philosophy. Because for decades, the traditional approach to student mental health has been incredibly reactive.
Like waiting for the problem to happen first?
Exactly. You wait for a kid to visibly break, and then you try to treat them in a vacuum. MentalSpace is attempting to dismantle the systemic roadblocks that create that vacuum, shifting the focus to supporting the entire school ecosystem.
Right. But to understand the mechanics of how they're doing this, we kind of have to look at the 3 specific roadblocks the sources identify first.
Yes.
Because the documents lay out this really painful irony. The students who need mental health support the absolute most are consistently the ones least likely to actually get it.
It's tragic.
It really is. And it boils down to 3 very distinct barriers, which are distance, cost, and trust.
So let's look at the sheer physics of that first barrier, distance. Especially in a state like Georgia where, rural districts are super widespread.
Oh, absolutely.
If a student lives 30 or 40 miles from the nearest licensed adolescent therapist, getting to a Tuesday afternoon appointment isn't just like a matter of scheduling.
Right. It's a massive logistical nightmare. I mean, it means a parent has to take a half day off work.
Which they might not be able to afford.
Exactly.
But
the student misses 3 periods of instruction. They have to pay for the gas. The friction is just so high that most families simply won't do it.
which bleeds directly into the second barrier, which is cost.
Yeah.
Even if there happens to be a clinic right across the street from the school.
Which is rare.
Right, very rare. But even if there is, out-of-pocket expenses for consistent weekly therapy are basically paralyzing.
Yeah, I mean, if you've ever tried to navigate the mental health system for yourself or a family member, you know exactly what we are talking about here.
Oh, totally.
A $40 copay every week is $160 a month. For a lot of families, I mean, that is the entire grocery budget for the week. It's a complete non-starter.
It really is.
But
Fixing distance and fixing cost still leaves that third barrier. And according to the strategy documents, this one is by far the most complex.
the trust barrier?
Exactly. Students of color face a massive trust barrier, constantly wondering if a therapist will truly understand their lived experience.
Yeah.
And we really cannot understate the psychological impact of that, because a student's lived experience is the entire context for why they are suffering in the first place.
That makes total sense.
If they walk into a room and immediately feel like they have to translate their culture or defend their reality to a practitioner who just doesn't get their background, they aren't going to open up.
No, of course not. You know, I like to think of this whole situation as a 3-legged stool.
Okay, well, I like that.
Getting a kid actual effective mental health care requires all 3 legs to be perfectly solid, right?
Right.
You've got geography, so can student physically get to the therapist? You've got economics, can the family actually afford the bill?
Which are the first 2 legs?
Exactly. But even if a school miraculously provides a completely free clinic right there on campus, meaning 2 legs of our stool are solidly bolted down, if the student fundamentally does not trust the person sitting across from them,
The third leg is missing.
the 3rd leg is missing, the entire structure collapses, and the kid still doesn't get help.
That is the perfect visualization for what MentalSpace is trying to engineer against here. They've built a specific mechanism to replace each leg of that stool.
Okay, so how do they do it?
Well, to obliterate the distance barrier, they rely entirely on telehealth. So the geography of rural Georgia suddenly just doesn't matter.
Oh, okay, wow.
And to neutralize the cost barrier, They aggressively accept Medicaid, which covers a massive portion of these vulnerable students.
Right. But setting up a webcam for telehealth and, processing a Medicaid billing code, those are just logistical fixes.
Sure.
I mean, anyone with a server and a decent accounting department can pull that off.
Right.
Building genuine systemic trust is an entirely different beast. How do the sources actually define fixing that third leg of the stool?
They use a very specific term for this. They call it culturally competent care.
Culturally competent care.
Okay. But they are super explicit in the documents that this cannot just be about checking a box. It requires a whole network of licensed therapists that are intentionally diverse.
Meaning what exactly?
Meaning they have to actively reflect the specific communities they're actually serving.
There's a line in the internal strategy document about this that really gave me pause. It states the ultimate goal is for a student to log into a session and, quote, feel seen before they even say a word.
Feel seen before they even say a word. I mean, it's an incredibly high bar.
It really is.
But the clinical reasoning behind it is fascinating. From a psychological standpoint, human beings are just naturally guarded, right?
Oh, absolutely. Especially teenagers.
Exactly. If a teenager logs into a therapy session and feels like they have to spend the first 20 minutes just explaining their cultural baseline.
Like having to explain what a specific microaggression feels like.
Yes, or what the neighborhood dynamics are like. If they have to do that, their defense mechanisms remain completely activated. They're essentially educating the therapist rather than actually doing the work of healing.
Right, right.
But when they feel intrinsically understood just by looking at the person on the screen, those defensive walls can drop almost instantly.
Okay, I do have to push back on this a little bit, though.
Sure, go for it.
Historically, we have seen massive institutions treat the concept of diversity merely as, a bureaucratic requirement. Like, a school board wants to look good on a brochure, so they hire a diverse staff on paper. How does a massive telehealth platform ensure that this culturally competent approach is actually felt by a skeptical teenager on the other side of a laptop screen?
That is a very fair point.
Like, how do they avoid this just being a corporate bullet point?
Well, you're absolutely right to be skeptical, because historically, that top-down corporate approach to diversity has been a total failure in healthcare. The sources address this by pointing out that true cultural competence requires systemic buy-in. It means the therapists aren't just diverse in appearance,
Right.
They bring licensed clinical expertise in navigating the specific sociocultural dynamics those exact students face every single day.
That makes sense.
And more importantly, MentalSpace realizes you cannot just drop a culturally competent therapist into a fundamentally broken school system and expect a miracle.
So the environment around the student has to change too.
Precisely. The ecosystem itself has to support the care. If the school culture is completely toxic, an hour of therapy a week isn't going to fix the underlying issue.
Which perfectly explains the 3 core beliefs driving their entire strategy. This is where we see the focus zoom way out, beyond just the individual kid in crisis.
Right.
So belief number 1 is that every student deserves access, regardless of income or zip code. We've kind of covered that with the telehealth and Medicaid.
Yeah, we did.
But belief number 2 is what really shifts the paradigm, I think. It's that every educator deserves wellness support.
That's a big one.
It is. And then belief number 3, every family deserves to be part of the solution.
Let's zero in on that second belief regarding educators for a second. The internal documents, quote, a phrase we've all heard a million times. You can't pour from an empty cup.
Classic.
Right? But let's apply that structurally to a school environment. A teacher is the primary adult interacting with these kids for 8 hours a day, 5 days a week.
Right. They're literally the front line.
Exactly. And if a teacher has 30 kids in a classroom, and let's say 5 of them are dealing with severe trauma, that teacher is absorbing an immense amount of secondary trauma.
Oh, wow. I didn't even think about that.
Yeah. If the staff is entirely burnt out, struggling with their own unaddressed mental health issues, the whole foundation of the school cracks. Student mental health cannot possibly thrive if the adults responsible for them are running on fumes.
It's essentially an environmental issue at that point.
Absolutely.
To make this tangible, let's look at the Georgia K-12 Initiative Overview document, because this shows what this ecosystem approach actually looks like when it's deployed in the real world.
Yeah, let's get into the specifics.
MentalSpace isn't just offering standard therapy for a few struggling kids. They actually assign dedicated therapist teams to each specific school.
Wow, per school.
Yes, per school. And they implement comprehensive crisis intervention, suicide and violence prevention protocols, staff wellness programs for the teachers, like you were just talking about, and even family counseling.
It really is a holistic defense.
Yeah.
I mean, they are surrounding the problem from every possible angle.
It's the difference between an emergency room mindset and a public health mindset.
Okay, unpack that.
Well, the traditional emergency room mindset is, waiting until a kid is in an absolute immediate crisis and then rushing them into a sterile room to treat them in total isolation.
Right.
But a public health mindset is about treating the water supply. It's about treating the whole environment.
I love that analogy.
Thanks. You're supporting the teachers so they don't burn out. You're bringing the parents into the conversation, and you're actively changing the actual culture of the hallways to prevent the crisis from happening in the first place.
But, and this is a big but, while the philosophy of a public health mindset is incredibly sound in theory, executing it across a massive state like Georgia requires heavy, heavy machinery.
For sure.
Think about what we're talking about here, delivering statewide 24/7 telehealth that includes crisis intervention.
Yeah.
You can't just, throw up a Zoom link and call it a day.
Because of the privacy nightmare, right? The sources actually mention that everything is strictly HIPAA and FERPA compliant.
Yes.
And for anyone who doesn't live in the administrative weeds, combining those two is a massive headache.
A huge headache.
You have FERPA, which aggressively protects a student's educational records, and then HIPAA, which aggressively protects medical records.
Exactly. And most schools historically avoid providing direct medical care precisely because they are terrified of a HIPAA audit.
Oh, I bet.
If a teacher accidentally sees a student's medical diagnosis, that's a massive violation. So MentalSpace has to provide a technological platform that completely walls off the medical data from the educational data.
While still, I assume, allowing the school to know that the student is actually receiving the care.
Right, exactly. And if we go back to your three-legged stool analogy, if the student ever feels like their private therapy notes are going to end up on their principal's desk, that trust leg instantly snaps.
Oh, yeah. Game over. So the technological infrastructure has to be absolutely ironclad.
It does.
But let's talk about the financial infrastructure, because earlier we mentioned Medicaid. How are they paying for the rest of this?
Well, the documents outline a financial net designed to catch almost everyone.
Okay.
For families on Medicaid, the cost of care is $0. Not a reduced rate, not a sliding scale, just zero.
Wow.
And for everyone else, they have integrated with virtually every major insurance carrier in the state of Georgia. We're talking Blue Cross, Blue Shield, Cigna, Aetna, UnitedHealthcare, Humana, Peach State, Caresource, and Amerigroup.
That is a massive list.
It is. By casting a net that wide, they are effectively neutralizing that cost barrier for the vast majority of the student population.
Okay, so they have the technology, they have the diverse staff, and they have the insurance billing all figured out. But I have a question.
Shoot.
Why is Georgia moving on this right now? Because according to the sources, there is a massive piece of legal leverage driving this entire initiative.
Yes, this is a very critical, time-sensitive piece of context. The sources detail how MentalSpace provides compliance support for a state mandate called HB 268.
HB 268.
Right. This legislation essentially forces school districts to have comprehensive, actionable mental health and safety protocols in place.
And there's a deadline, right?
A hard deadline, July 2026.
And keeping in mind today is April 12th, 2026.
So the clock is ticking incredibly loudly. School districts aren't just looking for like a nice-to-have wellness program to boost morale anymore.
Oh, no, they're staring down the barrel of a legislative mandate.
Exactly. They have to provide adequate support, and they have to do it right now.
Which means the superintendents and administrators who are actually signing these contracts need to see hard proof that this model works. They need data.
Yep, they need the numbers.
And the Georgia Overview document provides some pretty staggering outcome statistics. We are talking about an 89% rate of improved attendance among participating students.
89% is huge.
An 85% family satisfaction rate. And, get this, a 92% reduction in anxiety.
A 92% reduction, that is almost hard to believe.
Right. I mean, holding on for a second, because as a reader, those numbers are almost unbelievably high. A 92% drop in anxiety sounds like a marketing dream.
It does.
Does the source document explain the methodology there? Are we talking about students just self-reporting their feelings on a survey, or is this tracked clinical data?
It is likely a combination of symptomatic self-reporting and behavioral tracking. I mean, like that 89% improvement in attendance, that is a hard, trackable metric that heavily correlates with reduced anxiety.
That's true.
But even if we account for some, statistical enthusiasm, the sheer scale of that drop is really fascinating to analyze.
I have a theory on this, actually.
Or-
I want to connect it back to the logistics we discussed earlier, specifically the same-day access model they use.
Okay.
How much of that 92% drop in anxiety do you think is directly tied to the simple act of instantly removing the dreaded waiting list? Like, does the fact that a student doesn't have to wait 6 weeks inherently lower their anxiety right out of the gate?
That is a brilliant connection to make because, think about the psychological message sent by the traditional mental health system.
Right.
When someone finally breaks down and asks for help, and they are told, well, we can fit you in next month.
It's crushing.
It completely validates their deepest anxieties. It sends this subconscious message that their pain isn't urgent, that it's just, a bureaucratic scheduling problem to be managed.
It makes them feel like a number on a spreadsheet.
Exactly. But same-day access completely flips that script. When a student says, I am in crisis, and the system immediately responds with, we hear you, and here's a licensed professional right now, the relief is profound and immediate.
Wow.
Yeah.
You are actually treating the the anxiety of waiting for care alongside the underlying issue itself. It proves to the student that they are a priority, which is honestly the absolute fastest way to build that crucial foundation of trust we've been talking about.
That makes total sense. You aren't just treating the symptom, you're changing the student's entire relationship with the concept of getting help.
Precisely.
And real quick, for anyone listening who wants to see these numbers themselves or learn more, the sources mentioned, you can find this at mentalspaceschool.com or by emailing mentalspaceschool@uchitherapy.com.
Good to know.
So let's synthesize all of this, because we have covered immense ground here today, from the logistical nightmares of rural geography to the psychological complexities of systemic trust.
Well, the defining takeaway from these sources is that true mental health accessibility is not a single silver bullet.
Right.
You cannot just hire one counselor and call the problem solved. It requires a highly coordinated, multifaceted attack.
So hitting all the barriers at once. Exactly. It means utilizing secure technology, like telehealth, to completely cross geographic distances. It means creatively leveraging complex funding, like Medicaid and broad insurance networks, to eliminate the cost barrier.
Yeah.
And perhaps most importantly, it means demanding genuine cultural competence to build instant, authentic trust. You need all three working in perfect harmony to treat the entire ecosystem, so the students, the teachers, and the families.
And as we wrap up, I want to turn this directly over to you listening right now. Look at your own surroundings. Think about the schools in your neighborhood. What barriers to care do you see in your community?
It's a great question to ask.
If you've tried to navigate this system, are the students and families you know hitting the distance barrier, the cost barrier, or the trust barrier? Or maybe they're just colliding with all three.
And that really leads to a final lingering thought to mull over. We are watching initiatives like MentalSpace attempt to transform our schools into primary hubs for holistic mental health care.
Yeah, which is a huge shift.
It is. They are actively supporting not just the students, but entire family units and the adult staff working in the building.
Right.
So if this succeeds on a macro level, does our fundamental definition of a school need to evolve? Are we rapidly moving away from viewing schools as purely educational institutions and moving toward recognizing them as essential community health centers?
It fundamentally changes what those cinder block walls actually represent. They aren't just holding up a roof anymore. They are housing an entire community's well-being.
It's a powerful thought.
Thank you for joining us on this deep dive. Keep questioning the invisible infrastructure around you. Keep looking for the cracks. And most importantly, keep learning. Until next time.